Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. I'm Nur Shamlina Chair Abdul Rahim. My presentation is analysis of available nutrition recommendations to combat COVID-19, a scoping review. This study was published in Malaysian Journal of Medical Sciences. This scoping review is also available in technical report form and can be downloaded from N.C.A website. This is my presentation outline. The current COVID-19 pandemic remains severe. Currently, the spread of inaccurate information or fake news on the internet to the public is causing the community to panic. Nutritional status of individuals has been used as resilient towards destabilization during this COVID-19 pandemic. Optimal nutrient intake impacts the immune system, therefore. The public is sharing nutrition remedies that claim to cure or prevent this virus without support from evidence-based studies. Thus, these scoping reviews were used to obtain available information on food and nutrition related to the prevention and treatment of COVID-19 from various sources. This scoping review of empirical research and conceptual literature involved the following. Identify the research question, identifying the selecting relevant studies, categorizing resulting data, and collecting, summarizing, and reporting the results. Figure 1 shows the framework used to chart the evidence on the nutrition recommendation in COVID-19. A total of 60 articles met the inclusion criteria and were used in the scoping review. The date of publication ranged from 1st January 2020 to 10 April 2020. Researchers have searched and analyzed available recommendations by other countries infected by COVID-19. Figure 2 summarizes the types of data discussed in each nutritional recommendation in COVID-19. In total, 11 statements suggested eating healthy and nutritious food during pandemic can help our immune system to function correctly. We also identified 3 studies that included standard guidelines on nutrition therapy in the patient with COVID-19 disease requiring ICU care. Regarding treatment intervention against COVID-19, its studies suggested that high or mega doses of vitamin C have used intravenously in critical care setting to treat patients with COVID-19. A total of 9 studies explored the effectiveness of vitamin D in treating COVID-19, including 4 observational studies and expert opinion. Therefore, 5 studies suggested specific vitamins such as vitamin A, B, and E, and trace elements to treat COVID-19. We also recognized 8 studies reported that other macronutrients and minerals such as magnesium, zinc, selenium, folic acid with urine, and flavonoids improve viral infection. 6 studies proposed that TCM should be used to treat COVID-19 patients, and 14 types of herbs and miscellaneous foods that have been claimed to cure or prevent COVID-19 on the internet. The main facts of this study are drawn together and presented in this slide. Following the literature and practice search, most of dietitian and nutrition associations around the world have emphasized healthy eating habits and general guidelines for food preparation and storage. These guidelines also specify healthy and balanced dietary practices, including eating fruits and vegetables throughout quarantine and lockdown period. Based on our reviews, some convincing claims about vitamin C, vitamin D, micronutrients, and other minerals were made. For example, high-dose IVC has been used in China to help improve lung function in people with COVID-19. However, it is essential to note that vitamin C is not yet a standard part of the treatment plan for COVID-19. More research is further warranted in these areas of interest. This study synthesized that research-based analysis of available nutrition recommendation to combat COVID-19 By having a summary of the literature in this review, health professionals should be able to review current evidence and play their part to promote healthy eating among the population to prevent or reduce the severity of the disease. Even though there were many published journal post-COVID review publication, the fact remains that balanced, healthy eating is the cornerstone to maintain adequate nutrition for COVID-19. And that brings us to the end. I'd like to thank you for your time. If you have any questions or to collaborate in research, you can contact me at the following email. Thank you.